Good morning, viewers. Welcome to NOA River State Dialogue. Statistics have it, according to WHO, that 3.7 million kids under the age of 19 are infected with HIV, the virus that can lead to AIDS. It is the leading cause of death among preteens and teens. HIV, during the early stages of infection, can severely affect a child's development, whether related to physical growth, psychological involvement, or the emotional well-being of the child. It damages the immune system of the child. In addition, millions of children can indirectly be infected by the impact of the HIV epidemic on their families and communities. With me here in the studio this morning to discuss on the topic HIV/AIDS and child development is Dr. Francis L. Naziga. He is the project manager, River State Agency for the Control of AIDS, SACA. You're welcome, sir.
Thank you, ma'am.
I know you also belong to River State OVC Search Committee.
Yeah.
What is it about?
Thank you, ma'am. Well, the OVC Search Committee is actually a multi-sectorial committee that was set up to monitor the implementation of the OVC component of the search project in River State. The search project is actually the HIV program that is aimed at saturating the state with HIV response. So the committee monitors the activities of 9 CBOs, which are community-based organizations that are there to support what is being done in the health facility. Because as we talk about, which is key to or relevant to our discussion this morning, we're talking about HIV/AIDS and child development. So the work of these CBOs is looking beyond not just testing and linking these children to treatment, but also looking at this household. Where are their other needs? Because the child development would include physical development, the psychological development, the cognitive development, and a couple of other things. So, in the early days of the child, chronic illness and a whole of other factors affect their growth, as in this rhyme that we have discussed. The work of the committee or the CBOs is to see that they support these households of children living with HIV, or where their caregivers are living with HIV, with like nutritional support. They support these families with IGA, that is income generating activities. So that to enable the mother or the caregiver to be able to give food to the children, to be able to get little money for drug upkeep. You get the point now? Then they also look out for, through a kind of assessment, children that are supposed to be in school, but they are not in school.
Is it because of the HIV?
Well, it could be because of HIV. You know that, well, because the project is being supported by PEPFAR and CDC. Now, they have their conditions. But if you look at OVC project on its own, these other factors are there. So they are not just, so they are going a little bit beyond HIV to see that other needs of these children are also met.
Let me ask, why are we talking about, why are these children at risk of HIV infection?
So in the life of the child, let's look at the areas when we talk about children now. Let's look at 0 to 17 years, 0 to 10 years. Now, in the life of, if a woman is pregnant, if the woman is HIV positive and eventually gets pregnant, so there is that chance that in the 9 months of pregnancy, within the period of delivery and the period of breastfeeding, these 3 phases of bringing out a child, the children have different degrees of risk of being infected with HIV. And there is a particular program or strategy that is designed to reduce or prevent this, and that is what we call PMTCT, that is Prevention of Mother to Child Transmission of HIV. What are we discussing here is that because there are these drugs, when a woman is enrolled on this program, eventually, if she follows it up judiciously, then it reduces the chances of her child being infected to as little as 2%.
Oh, really?
That is how effective it is. And there are a lot of, we have testimonies, we have statistics within the state that if beyond here, I can provide them, and you can also see the children, you can see the mother, you can see the child that I am positive, my child is not positive. I haven't passed through this program. Okay. But I need to quickly put out that if you have 100 women that are HIV positive, okay, all the 100 women are also pregnant. They are HIV positive, okay, they are pregnant. Okay. Nature, or we call it God, has so made it that out of these 100 women, they don't even know they are positive, so to say. They do not do anything. They do not take drugs. They don't do anything.
They just go for the normal,
or they didn't even go for the antenatal. The statistics is available that between 60 to 70 of these women, their children will be negative.
Really?
Let's get that.
Okay.
So the question might be, so why the PMTC program?
Yes, why?
So PMTC program is focused on the remaining 30 to 40%.
Okay.
That's where we are. Nature has already taken care of 60 to 70%. Okay. But in these other 30 to 40%, that's where the program is now focused to also further reduce it. Okay. I want to make it clear that in other parts of the world, or in some parts of the world, they've actually achieved what we call elimination of mother-to-child transmission of HIV. I can make sure in a country like Belarus, okay, there are a couple of other ones, but for now, for the purpose of
Belarus, okay,
yeah, they have eliminated. That is to say that all the women in that country that are HIV positive eventually have children that are HIV negative by complying with the principle of the PMTCT program. Okay. So this is the picture, and so the discussion is that if there is this hope, then we needn't allow these children to pass through the trauma of being infected. Because imagine a child that is infected. Today, with the treatment that are available, the child will definitely live long, but then he's living with the sickness. And later on in life, as we know, the HIV have this component of when somebody lives with HIV for a long time, they are exposed to certain cancers and all of that, and so many other things. Their life is definitely, in as much as the quality has improved, it's definitely not as same as a child that do not have it at all.
Okay.
So
what can be done to support this prevention of HIV among children?
So the work
vulnerable children.
Yes.
What can be done?
A lot of things can be done. Okay. One is to control, to create awareness, which I think what we are doing is part of it.
Okay.
And let our parents, both men and women, know that these services are available. Okay. PMTCC have 4 prongs. The first prong is that you try as much as possible to make every woman within the reproductive age that they should not have HIV. And so that it goes to the traditional method of ABC, that is abstinence, being faithful, use consistent and correct use of condoms. And the last now we are talking about drugs, to be on drugs. So that's the first prong. The second prong is, yes, a woman is within reproductive age. So try and avoid unwanted pregnancies in this woman, because every pregnancy carries a risk.
Yeah.
So you educate the woman, should be educated. She should know that, look, I have HIV. I shouldn't just get pregnant anyhow. I need to get pregnant when I really need it. Okay. So contraceptive measures are there. We take advantage of the dual protective nature of condom. Condom protects, prevent pregnancy, and at the same time prevent against STIs. Okay. And HIV is also seen as an STI, as sexually transmitted infection.
Yeah.
Now, if you are past these 2 stages, now the woman is HIV positive, she is pregnant, then enroll her on the PMTCT program.
Okay.
And where she eventually, and I want to make it clear that the River State government has actually made it, the governor like 2 years ago has declared that every woman that is HIV positive, their antenatal fee is free. So they can actually come to our health facilities and access antenatal care free of charge, and take these life-saving drugs that will both increase their own quality of life and also prevent their children
mother-to-child
transmission of HIV. So that's the third prong. The last is that when you've done all of this and you didn't succeed, you have a woman here with HIV and a child here with HIV, then you need to support her family and her community. Because HIV, as you know, is a community sickness. It goes beyond the individual to the household to the community. So these are a lot of things that can be done to see that we reduce the chances of children being infected with HIV. Eventually, if they are infected, then the drug treatment.
I'm going to take you up on that. Now, viewers, you can send in your comments, questions, and suggestions on this program. If you have someone that is infected, If you are infected or you want to know more about the prevention programs that are available for people or children that are infected, you can send in these questions and Dr. Naziga is here to answer all your questions. Now, to take you on the last part, I'm interested in the last part you talked about when the case where you have the mother infected has been transmitted to the child,
okay,
right?
Yeah.
So what are these programs to help that child?
Okay, so
are there programs
yes,
now?
Yes,
Yeah,
which is what I have talked about in the search committee.
Okay.
So in Rivers State, the government working through our partners have actually made available treatment for HIV both for adults and for children.
Okay.
Now we're working with IHBN, that is Institute of Human Virology, okay, and then the IHBN, which we call the lead partner. We have other people working in the state like Pop Council. We have okay, so IHBN on their own sublet some part of the OVC program to an organization called WIWI. And then WIWI again has engaged 9 community-based CBOs, community-based organizations.
Okay.
So HIV screening is available in our health facilities and it's free. That's the first stage.
Okay, that's the first
one.
one.
We have discussed. Now, when a child is identified, then this child is put on antiretroviral therapy.
Okay.
Do you get the point?
Okay.
And these drugs are available and are free. I will tell you that with all confidence that there are cases where the health facilities, the people in the health facilities even go as much as far as taking these drugs to the child's home, where they are unable to come and pick it up.
That's good.
Then we do what we call viral load monitoring, because the aim of treatment is to achieve viral suppression, both in children and in adults. Okay, when a child is virally suppressed, then you see that their quality of life is obviously as good as the other children.
Okay.
So these are the programs that are available, and they are available in all the 23 LGAs, both in private and public facilities.
But how effective is it?
How effective is it?
Very effective.
No,
all the local government areas?
Very effective. See, because why I'm telling you that it's very effective is that I have told you about. I think I mentioned the search committee several times.
Yes,
let me mention it maybe for the last time. Why? To talk about effectiveness. This committee consists of representative of the House of Assembly, representative of Ministry of Social Welfare and Rehabilitation, the NGOs, civil society organizations. We have representative from SACA, and because the work of the committee in trying to push and the successes around the children pediatric treatment of HIV in Rivers State, 2 weeks ago, we have representative from Federal Ministry of Health and representative of Federal Ministry of Women Affairs that came to Rivers State to understudy the work of the committee, because the report from Rivers State for children living with HIV is there in the national, has echoed in the national, to the extent that they send these persons to come to Rivers State to learn, because they are trying to adapt what we are doing in Rivers State for children when it comes to HIV in other states.
In other states.
Yeah, so
I'm just curious. These drugs that have been administered, to help these children that are infected with the virus, is there any negative impact of it on the child? Does it affect the development of the child in any way? Apart from suppressing the virus?
So
I'm curious. I just want to know.
Well, you're curious, but see, I will have this to say. Even paracetamol have side effects. Anything called drugs have side effects. So what is done is that, yes, whether on children or on adults, taking drugs, and these are highly potent drugs. Sometimes they can have some side effect on the children, but not enough to stop us from using it. Now there is what we call pharmacovigilance. So there's a component of the management of these children or even adults where you look out for, is this child or is this adult, do they have complaint after taking the drugs? And this is reported back to the health facility, and they look at it and see if there is the need to adjust either the dose or to change, because there are different regimens. So it's not really just one drug. So if this one is not good for you, you can be shifted. That can be that shifting to another drug. These are available for both children and for adults. So these are what is done about it. So and people should be encouraged to go ahead and take these drugs.
Now we have some comments coming in. I'm going to take from Mr. Chinwe Okwara. He says, does HIV/AIDS still exist? In recent times, there is low level of awareness against HIV and AIDS. government should intensify efforts in sensitizing parents and children. You know, I want you to answer that. I'm going to ask. I want you to answer that, especially with the onset of the COVID-19 pandemic. Okay. Nobody is talking about AIDS anymore.
Yeah. So if we are not talking about AIDS anymore, if we are not talking about AIDS anymore, then it's our fault. Yeah. Because HIV is there. Okay. It has always been there. Mm-hmm. It's yet to be eliminated. Today, by the statistics that was carried out in Nigeria, what we call the NICE Summit in 2018 and released in 2019, the national prevalence for HIV in Nigeria is at 1.4%. That puts 1.9 million Nigerians living with HIV. In Rivers State, we have a prevalence of 3.8%, which is the third highest in the country. Wow. Second to Benue, which is second, and then Akwa Ibom, which is the first. So at present, we have over 120,000 persons taking treatment for HIV in Rivers State, and we have over 2,504 children that are also on treatment. So HIV is there, it's real. So
these figures that you have just mentioned, it's alarming.
But that is the truth. I'm giving you a factual. Yes, if you see, I said over. So I'm using the last verification we did. Mm-hmm. That means that if you go to the very current information, it will be some numbers ahead of over.
That's for those that have actually come out to say that we have those figures.
Yes, I'm giving factual information figures, that are verified.
Yes. So why? What is the cause? Is it because of the COVID-19 that you're not talking about?
So COVID-19 is not the cause. The issue is that the HIV is a behavioral sickness. Okay. Let's look at adult now and leave the children. Okay. That because it's the one eventually from the adult most times that gets to the children. Especially let's talk about the under 10. Okay. We will know that within 0 to 13 years, about 90% of HIV infection is from their infected mother to the children. Okay. However, there are certain things that are happening. I'm saying so that I know our time is short, but you know that some research have shown that the age of sexual debut, which is the age at which people start sex, in Nigeria has dropped to 13 years.
Really?
So that is it. So these are some of the factors. So for the older children between 13 and 19, their sexual activity can expose them to HIV. Okay. And when somebody indulges in sex at an earlier stage, one, they don't have much information. Mm-hmm. The condom, safe sex practices are neglected. Most times they have, especially like the girl child, they are having this sex with an older person. And so they cannot even negotiate safe sex practices. So that is for the children. But for the adult, it's a behavioral thing. And behavior change is one of the most difficult things you can talk about. Yeah. Look at yourself and any other person in the church. This preaching that they've been doing over the years. Yeah. You remember where we are. Yes. So we go to the traditional risk factors. We'll talk about poverty. We'll talk about ignorance. We'll talk about competing needs. What do I mean by competing needs? Today, we even have pregnant women delivering in TBA, delivering in churches. Yes, why the health facility is available there. Sometimes they talk about cost. They will talk about spiritual needs. There are a lot of other things. We'll talk about intergenerational sex. That is having, let's say, older men having sex with younger women. All of these are predisposing factor to having HIV. Yeah. Poor use of condom. Most times our people are not using condom consistently and consistently in the way they should do it. I'm talking about sex outside regular relationship. Okay. And then people again, a lot of people still don't know their HIV status. Yeah. So the first thing is go out there, go to the health facilities and do your HIV test. Yeah. Know your HIV status. Mm-hmm. Because if you are negative, then you need to protect it. Yes. If you are positive, then assess the available services that we have in the state. Mm-hmm. So we do not have reason why we shouldn't stay free from HIV. So these are these multiple factors that affect issues around HIV. And even as somebody have just asked, some people are even still in doubt that HIV is not there. Yeah. And then because we also have other competing things that are coming out like COVID-19, it's dragging attention from HIV. Mm-hmm. But HIV is there and is there and is there, and something needs to be done and seriously about
it. Yes, because the figures are alarming now. You know, I heard from Mr. Ellis in Riadapa. He says, how can one contact the Rivers State Agency for the control of HIV/AIDS for assistance? Because people out there, some of them don't even know where to go to. They are afraid. You know, so
where the River State Agency for the Control is located at number 4 Moscow Road.
Okay.
The Chief Emmanuel Aguma House.
Okay. Can you repeat that?
River State Agency for the Control of AIDS is located at number 4 Moscow Road, Chief Emmanuel Aguma House,
okay.
adjacent to Port Harcourt City Council. But then you don't need to come to that place. All our health facilities offer HIV services. The thing I'm discussing is not River State Agency for the Control of AIDS. I'm talking about HIV response in River State, which covers River State Agency for the Control of AIDS, which covers the Ministry of Health, which covers all the other partners that are working together. So even we are even taking the services are even being taken into the communities. Okay. People go to the communities and test people, even in the TBA, traditional beta center. We are doing testing there. So you don't need to come to SACA before you have issues. Yeah. Okay. As I've said, in the 23 LGAs, HIV services are there. We have what we call Local Action Committee of AIDS in the LGAs. We have what we call HIV Dex Officer in the in the primary health care component of the LGA. So these personnel are there. The health facilities are there. So go and uptake services, go and get more information. I just want to bring on board again a little information. We have what we call the key population.
Okay.
The key population is a special subpopulation that are at higher risk of acquiring HIV. And by the document guideline that was released just like 2 weeks ago, they have increased from what we used to call men who have sex with men. It used to be female sex workers. Now they have changed it to sex workers because we now also have male sex workers as well as female sex workers. We have people who inject drugs and transgender population. These are another new group they call transgender. These are people who they say, let's say a woman says she's transiting to be a man. And then you have a man transiting to be a woman. These people, because of the complex psychological thing around them, their sexual behavior is a bit wild and expose them to risk of HIV. And then we have people in correctional settings, normally called prison. These people also are at higher risk of HIV. Now, this group of persons poses a whole lot of risk to HIV, and even in the state, we are also doing a lot of work to address such subset of people in River State.
Okay.
So lots is being done.
Yeah. Thank you, Mr. Ellis Dapa. He says kudos to NOA and the doctor in the studio. You know, while talking, Mr. Naziga, you know, we talked about you have some of the challenges you have about maybe traditional birth attendants. You say you are doing there's testing going on.
Yeah, testing. We have so identified them,
okay.
And now some of them have even been brought for training.
Okay.
So we now send people there to go and test. You say, madam, we are not stopping your business.
Okay.
Continue with your business if these people prefer you, but do one thing: test for HIV. Okay. And the ones that are positive, give them back to us in the health facility.
Okay.
Because we can better take care of them.
Manage them.
Okay.
Yeah. Okay. So, what about those so-called some more spiritual churches? What have you done about those ones? Because they exist.
Yes, they exist, and we are also trying to reach them. The HIV program was so programmed that structured that we have what we call Interfaith. Interfaith is an organization of religious leaders that are also equipped to talk to religious leaders.
Yes.
Funding might be an issue, but we have those structures. We have another group they call NANAREDA, which is the association of religious leaders that are living with HIV and affected by HIV. We also have such group in the States.
Really?
And all of these groups are trying to interface with the religious system.
Okay.
I also know that some churches have their own HIV program units. I'm aware of that. I've been to a couple of, I know the Catholic Church have, I know the Anglican Church have, I know Equa Church have, but it might not be global, but some pocket of them also have HIV programs where they are also using their own little setting to educate and sensitize their members.
Okay, Doctor, I'm going to ask you to give your number today in case you know that people that don't want to send comments here, but just want to find out more, about this. But do you have barriers to this HIV testing for infants and children? We're talking about child development.
There is no way you can say you are doing something and there will not be barriers. No, of course the barriers come from, like now I use this as an example. Now when a child, barriers to testing might be information, might be willingness, which is generally there. Some people want to test, they don't know where. This is around there in their community, they don't know they are there. So we'll continue to do education, to sensitization to see that people are aware. But again, even the quality of service that the child gets also depends on the parents. I was discussing yesterday, I don't want to go too specific. and we have this child that is due for viral load. Viral load is the test you do to check the quantity of the virus in the child or in somebody that is infected. Okay. To also know how well is the treatment. And I know they've been begging the father. I am talking about what I know. They've been begging the father, okay, bring your child to the facility to come and test. And so we have, because the children's life is not within, is like related to that of their parents. Okay. It's not within their control. Okay. The activity of parents also affect how quality these children can assess themselves. And this father has not come. He promised he will come tomorrow, he will not come. He promised the drugs was even taken home to wait for him that if you come, we'll give you the drugs. Then bring the child, let us come. So you understand now? Yeah. So there are a lot of children that are HIV positive that their parents are not bringing them to come and take their drugs. Okay. And so we are encouraging parents, if you have a child that is positive, please, for the sake of this child, these are human beings. Yeah. You come to the facility, take these free drugs that are there. If you even come to the facility, I am saying it, and I'm saying it with all certainty. If you even come to the facility and you say, see, you don't have money, they will even give you small transport coupon to be able to
go back.
Yes,
so that's great. So we're glad to hear that.
That's true.
We have from Ifoma Unachukwu Obele. It says, well done, doctor. And he's saying, thank you, doctor, for the information. And anyway, and then she's asking, why hasn't a vaccine for HIV developed?
well, HIV is a complex virus.
Yeah.
It has undergoes a lot of frequent mutation.
Yeah.
And that has disturbed the scientists from being able to key into a particular. It's like today you identified this, and the next day it has mutated, and so scientists are also keep trying. But what we can say that there are a lot of advances in treatment today. There are available drugs. It may not be everywhere yet that they can take the injection once in 2 months instead of taking the drugs every day. So there are a lot of advances that are coming up there. So in the nearest future, we might have people take drugs just once in 2 months, maybe once in 6 months. So scientists they keep working.
So there's work going on that. I have from Senibo Abiye. I know our time is running off. He says, what are the factors that is making one state more prevalent than the other?
Well, okay, we'll now take a little look at Rivers State. Rivers State is seen as the economic nerve center of the South. Okay. A lot of people, there's traffic of human beings
coming in and going out.
Yeah. So these economic opportunities, it makes us at risk in that. Look at our streets. See how the government is struggling to remove people from the streets. Yes. Then when you go to other states, their streets are empty. You go to other states by 6 p.m. there is no traffic. Here in Rivers State, even by 10 p.m., even on Sunday, there is traffic. It's to tell you the number of human beings that are here looking for survival. And what comes with this survival is also this rather dangerous. So those are some of the factors.
Okay. I have from Bibiba Princeville. It says HIV/AIDS is not a death sentence, like you have said. So anyone affected or infected should visit the nearby health center or hospital to enroll in the treatment for mother-to-child transmission. The doctor has just said, he has said a lot concerning that. You know, our time is running up. Just give us one last word for the people, and don't forget to give us your phone number in case someone wants to reach you. You know, because not everybody, is ready to, talk out there. And this program goes really far and wide. Somebody might just be there, just want to hear you talk.
Well, it has been an interesting time being together. My phone number is 0803 6677 168. Once again, 0803 6677 168.
Okay.
Now, my last word is that HIV is real. It is not a death sentence, but we need to take personal responsibility to issues around HIV. Come to our health facilities, access information on the internet so that we can have an HIV-free generation.
Okay, thank you so much, Doctor. And from Mr. Bekimbo Williams, say government, parents, and more so, health professionals should educate, diagnose, and prescribe. Medical professionals should be proactive in all. Thank you, viewers, for streaming with us today. And I want to thank the doctor in the house. You have said so much, so much. I didn't know a lot of these things existed, and I'm sure a lot of you out there didn't know that government had these programs in place for the mother, for the child, all aiming at preventing mother-to-child transmission, and also for active development of the child. Like we have said, HIV/AIDS is not a death sentence. You have to take personal responsibility. Go out there, do the test yourself. If you are negative, you will be told how to live
to protect
it.
Yeah.
And if you are positive, there is help for you.
Yeah.
If that child is positive, there is help for you.
Child.
And I've been told here that you don't even have to pay anything. Everything has been provided for. So help that child become a better person tomorrow. This is the program of the National Orientation Agency, Rivers State, and it is supported by UNICEF. Thank you.
Thank you.